Today, we're going to explore 4 exercises, activities, and methods that can help improve your sexual performance and overall function as a man. These are natural, practical approaches that focus on improving the health of your body in a very specific way. By boosting your blood flow and strengthening key muscles that support erections. When we talk about sexual performance, most people think it's all about testosterone or desire. But the truth goes deeper. A strong and lasting erection depends mainly on how well blood flows into the penis. That's right. It's a vascular process, which means it has everything to do with your circulation. Of course, the nervous system, hormone levels, emotions, and mental health all play a role. But without proper blood flow, none of that can work as it should. That's why this topic matters. If the blood vessels that carry oxygen-rich blood to the penis are healthy and open, erections are stronger, firmer, and easier to maintain. But if that blood flow is weak or blocked, sexual performance suffers, no matter how high your desire is. In this video, we'll break down some proven methods that support your erection naturally by improving the flow of blood, especially in the pelvic area. We'll talk about simple exercises you can do at home, useful tools that improve circulation, and smart ways to protect your vascular health, all focused on helping you feel more confident, capable, and energized in your intimate life. Let's start by understanding how blood actually travels to the penis and why that process is so important for a full and healthy erection. For a man to have a strong and lasting erection, one of the most important things is healthy blood flow. That starts with good vascular health, especially in the lower part of the body, known as the pelvic region. When the blood vessels in this area are working well, more oxygen-rich blood can reach the penis. That's what allows it to become firm and stay that way during sexual activity. Here's how it works. Blood travels through a system of arteries, starting from the heart. One of the main blood vessels in the body is the abdominal aorta, and from there, a branch called the internal iliac artery sends blood toward the pelvis. This artery gives rise to a smaller branch called the internal pudendal artery, and this is the main artery responsible for carrying blood to the penis. From the pudendal artery, even smaller branches spread out, including the cavernous arteries, the penile artery, and the dorsal artery of the penis. These tiny blood vessels deliver fresh, oxygen-rich blood directly into the erectile tissue, which is what creates a full and satisfying erection. When these arteries are open and flexible, blood can move freely. That's why medications like tadalafil and sildenafil, known as vasodilators, are often prescribed. They help relax and widen these blood vessels, allowing more blood to flow into the penis. But medications aren't the only way to improve this. There are natural methods and exercises that can also help increase circulation, support the pelvic floor, and strengthen this entire system. Let's look at the first one. Method 1. Pelvic floor Kegel exercises. One of the most effective ways to naturally improve your sexual performance is by doing pelvic floor exercises, also known as Kegel exercises. These exercises help you strengthen the muscles at the base of your pelvis. These are the same muscles that play a key role in your ability to have and control erections, as well as to ejaculate. But that's not all. These muscles are also involved in controlling your bladder and your bowels. So keeping them strong has many health benefits beyond sex. When these pelvic muscles are weak, it can be harder to keep an erection or control when you ejaculate. But when they're strong, everything works better. With more control, more power, and more confidence. Now let's look at how you can find these muscles and start training them the right way. A good way to find your pelvic floor muscles is by paying attention the next time you go to the bathroom. As you start urinating, try to briefly stop the flow of urine. The muscles you use to do that, to squeeze and hold, are your pelvic floor muscles. You don't need to do this every time you pee, but it's a simple way to identify the right area so you can begin doing the exercises properly. Once you've found the right muscles, here's how to start your routine. Tighten those muscles and hold the squeeze for about 5 seconds, then relax for another 5 seconds. That's 1 repetition. Aim for 10 repetitions in a row and try to do 2 to 3 sets each day. To see real results, stay consistent for at least 6 weeks. Over time, this simple routine can help improve your erections, give you more control over ejaculation, and even support bladder and bowel health. Now let's move on to another powerful method that uses gentle pressure to increase blood flow directly. Method 2. Penile vacuum pump, vacuum therapy. Vacuum therapy is a method that uses a special device called a penile vacuum pump. It's often used to help men recover their sexual function after prostate surgery, especially after procedures like a radical prostatectomy. But it's not just for surgery patients. This therapy is also helpful for many men dealing with erectile dysfunction for other reasons. It works by encouraging healthy blood flow into the penis, which helps the body relearn how to respond naturally. The vacuum pump is a cylinder-shaped device that fits over the penis. When turned on or pumped, it creates negative pressure, basically a gentle suction. This suction pulls more blood into the penis, helping to create an erection by boosting blood flow in a natural way. There are 2 main types: manual pumps, which you operate by hand, and automatic pumps, which run with the push of a button. Many people prefer automatic ones because they're easier to use. Before buying one, it's a good idea to talk to a pelvic floor specialist or physical therapist. They can help you choose the right device for your needs and make sure you're using it safely and effectively. To get the best results, vacuum therapy should be used 2 to 3 times a week, though some people use it daily. Just make sure each session lasts no more than 15 to 30 minutes to avoid harming the tissues. Some men use a silicone ring at the base of the penis after removing the pump. This helps maintain the erection for a longer time by keeping the blood from flowing out too quickly. But be careful. Using the pump or ring incorrectly can cause problems like pain, bruising, or even tissue damage. That's why it's so important to start under the guidance of a professional. Interestingly, research shows that when vacuum therapy is combined with medications like tadalafil, a common vasodilator, it can lead to better recovery and stronger erections than using medication alone. Now let's explore a third method that might be new to you, and just as powerful. Method 3. Penile extender device. The penile extender is a device that's not talked about as much, but it's actually used quite often in physical therapy protocols for improving sexual function. It's a simple device that fits over the penis and applies gentle, consistent stretching. Over time, this can help improve both erection quality and penile length. Although it's not as widely discussed as other methods, many physical therapists recommend it as part of a comprehensive plan for treating erectile dysfunction and even for lengthening the penis. While it might not be as well known in everyday conversations, this device can be very effective when used properly. The penile extender works by applying gentle traction to the penis. It's important to note that the device needs to be custom-fitted for your size to work effectively. You should follow specific guidelines for how much pressure to apply and gradually increase the time you wear it. If you're consistent with its use, typically for 1 to 2 hours a day, over 3 to 6 months, you may start to see improvements, not only in erection quality, but also in penile length. This method works by encouraging the tissue to adapt and stretch, which can lead to a stronger erection and more confidence in your sexual health. However, it's essential to use the device properly. The right fit and gradual increase in time are key to ensuring you don't cause any injury or discomfort. Method 4. Reverse Kegel. A reverse Kegel is essentially the opposite of a traditional Kegel exercise. Instead of tightening the pelvic floor muscles, you're relaxing and stretching them. This helps to improve blood flow to the penis, enhance the relaxation of the pelvic muscles, and support the proper functioning of the erectile tissue. The reverse Kegel focuses on releasing tension and allowing more blood to flow freely to the area, which is important for achieving and maintaining a full erection. Find a comfortable position. Start by sitting or lying down in a relaxed position. Breathe deeply. Inhale deeply through your nose, allowing your belly to expand as you breathe in. Engage the pelvic floor muscles. Now, instead of tightening the pelvic floor, focus on relaxing and gently pushing the muscles downward, toward your rectum. You should feel a sensation of letting go, almost like you're trying to release urine or pass gas. Hold and release. Hold the relaxed state for 3 to 5 seconds, then slowly release and relax for another 3 to 5 seconds. Repeat the process. Repetition. Perform 10 to 15 repetitions, working up to 2 to 3 sets a day. Important that these helps to increases circulation to the pelvic region, improving blood flow to the penis. It promotes muscle relaxation, reducing tension in the pelvic floor, which may lead to better control over erections. It can help counterbalance the effects of tight pelvic muscles, which can contribute to erectile issues. Performing the reverse Kegel alongside traditional Kegel exercises, which involve tightening the pelvic muscles, will give you a well-rounded approach to pelvic health and sexual function. Now that you've learned about these 4 powerful methods, it's time to take action. Whether you're doing pelvic floor exercises, using a penile vacuum pump, stretching and strengthening your pelvic area, or improving your lifestyle habits, consistency is the key to seeing real results. By incorporating all of these methods into your routine, you can boost your sexual health, improve your erections, and feel more confident in yourself. Remember, confidence is directly tied to the way you feel about your body and your sexual performance, so don't underestimate the power of these changes. Taking action today will set you on the path to better sexual function, more confidence, and an overall healthier life. Keep practicing and enjoy the benefits that come with commitment to improving your sexual well-being. If you found these tips helpful and want to stay on top of more ways to improve your health and well-being, make sure to subscribe to the channel. By subscribing, you'll get easy access to all of our latest content, including more exercises, health tips, and lifestyle changes that can help you feel your best. So hit that subscribe button and don't forget to click the notification bell so you never miss out on any updates. Let's continue this journey together toward better health, stronger confidence, and a more fulfilling life.